Okay, let's unpack this. Imagine you're managing a chronic condition, something serious and progressive like chronic kidney disease or CKD.
Right.
Now, picture the daily reality. Maybe juggling, I don't know, a dozen different prescribed medications, sometimes even over 20 pills a day. That is a significant burden.
It absolutely is, and it creates this huge challenge for patients and for healthcare providers too. Medication adherence,
Sticking to that complex regimen.
yeah, consistently. It's just paramount for slowing CKD progression, preventing serious complications, and delaying or even avoiding outcomes like needing dialysis or a kidney transplant.
And the reality is, non-adherence is a major issue. The rates for CKD patients can be quite high, can't they?
Oh, definitely. Anywhere from, say, 12% to over 50%, depending on how advanced the disease is. And when patients don't take their medications as prescribed, well, their kidney function declines faster, leading to worse overall health.
Exactly. The source material we're looking at today really highlights a stark consequence for kidney transplant patients, actually.
Yeah.
Poor adherence makes graft loss 7 times more likely. 7 times.
Wow. Yeah, so finding effective ways to support patients in taking their medications is absolutely critical.
So the material for this deep dive, it comes from a recent study published in partnership with Seoul National University Bundang Hospital. It's a randomized controlled trial, an RCT.
Which is, the gold standard for testing if an intervention really works.
Right. And this study looked at a novel approach to improving medication adherence specifically for these CKD patients.
So our deep dive today focuses on this pharmacist-led mobile application designed specifically for individuals living with CKD.
And the study tested whether this app called Kidney Health could genuinely help patients stick to their medication schedules
Uh-huh.
and potentially improve key health outcomes over a 3-month period when compared to just receiving standard care.
So our mission basically is to really get inside this study,
Hmm.
understand the scale of the problem first,
Yeah.
see exactly what this app and the pharmacist intervention involved, analyze the results, both adherence and clinical outcomes, and then figure out, well, what could these findings mean for better managing chronic kidney disease?
Okay, so let's start by framing that challenge then. CKD, it's irreversible, gets worse over time.
And globally, it's a major health crisis. It's actually ranked as the 12th leading cause of death worldwide.
And the source points out its high prevalence in many regions. For instance, it estimates over 7 million cases in Egypt alone back in 2021.
Wow. So this is a condition impacting millions upon millions,
Yeah.
making the burden of managing it, including that pill load we talked about.
Yeah, that huge pill load.
A really widespread issue.
Yeah.
That sheer number of medications, you said 12 to 19 different prescriptions, sometimes over 20 pills daily, that is a direct barrier to adherence. It's just so easy to forget doses or get confused or just feel overwhelmed.
Which brings us right back to those non-adherence rates, seeing numbers like 12% to 53% non-adherence among CKD stages 3 to 4. Well, isn't surprising given the complexity, is it?
Not at all. But it highlights this crucial area where we desperately need better solutions.
And the sources suggest a couple of avenues show some promise. Pharmacists, for one.
Right. With their expertise in medications, they can play a vital role. Optimizing therapy, identifying reasons why someone isn't adhering, providing that tailored patient education.
And patient education itself, just improving a patient's understanding of their condition and meds, that's also key, isn't it?
Definitely. And this is where technology, specifically mHealth or mobile health, kind of enters the picture.
Right. The idea that digital tools like mobile apps can help patients manage chronic conditions, encourage healthier behaviors, potentially improve outcomes. It's gaining real momentum.
Think about the explosion of mobile internet use. The source notes Egypt had around 70 million mobile internet users by 2023. The potential reach for health interventions via mobile is enormous.
And that brings us directly to this study and the Kidney Health app. How did they actually set up this RCT to test its effectiveness?
Okay, so they conducted a single-center prospective trial over 3 months. They enrolled 86 patients with CKD, stages 3 through 5.
Okay.
And these patients were also dealing with polypharmacy, taking 5 or more prescriptions daily. And they needed to own an Android smartphone.
Ah, okay. An Android phone specifically.
Yeah. Then they were randomly assigned to one of 2 groups, 43 in the app group, 43 in the control group.
And the control group got standard care routine monthly clinic visits.
Exactly. The app group also got that standard care, but in addition, they got access to the Kidney Health app after getting training from a pharmacist on how to use it.
Okay, so training involved.
Yes, and importantly, Both groups had those monthly follow-up interviews with a pharmacist.
Ah, okay. So this wasn't just like download an app and you're on your own. There was a significant human professional component involved here.
Absolutely, the pharmacist was key.
So what features did the app actually provide then?
It was designed with several patient support features in mind. It offered personalized medication reminders, and patients could actually tap to confirm whether they'd taken their dose.
Okay, like an active confirmation.
Right. It included educational content about CKD and their specific medications, which even had short quizzes to check understanding.
Oh, interesting.
Patients could also manually log health data lab results, symptoms, side effects, and view trend charts for their measurements. And crucially, it included a feature to directly message questions to the pharmacist.
Okay, so reminders, education, tracking, and direct pharmacist communication. Seems pretty comprehensive. How did they measure if all this actually made a difference?
So the primary measure was medication adherence. They used a standard questionnaire, the Simplified Medication Adherence Questionnaire, or SMAQ.
SMAQ, got it.
Then they also looked at secondary outcomes, important clinical markers, things like kidney function measured by eGFR and serum creatinine, blood pressure, hemoglobin, weight, and random blood glucose. They also tracked how much patients used the app and how easy they found it, using a usability scale called ACES.
All right, the moment of truth then. What did the study results reveal? Starting with the big one, medication adherence. Did the app help patients take their meds more reliably?
It showed a pretty dramatic improvement, actually. Looking at the percentage of patients classified as adherent by that SMAQ questionnaire,
Yeah.
the app group saw a really significant increase over time. At the start of the study, only about 9.3% of patients in the app group were adherent.
Just 9.3%. Okay.
By the end of the 3 months, that number jumped to 74.42%.
Wow. From less than 10% to nearly three-quarters adherent in just 3 months. That is a massive shift.
It really is. When they compare the app group directly to the control group, the app group had a significantly higher percentage of adherent patients at both the 2-month and 3-month marks.
What about the control group? Did they improve at all? They did see some increase in adherence over time, yeah. Possibly because of those monthly pharmacist interviews everyone got. But it didn't reach the level or the statistical significance seen in the app group. It lagged behind.
This study also looked at how quickly patients became adherent, didn't it? Using that Kaplan-Meier analysis.
Yes, exactly. That analysis looks at the probability of an event happening over time, in this case, becoming adherent. And it showed the app group had a significantly higher probability of achieving adherence over the study period.
So they got there faster, basically.
Basically, yeah. The median time it took for a patient to become adherent was faster in the app group, around 2 months, compared to 3 months in the control group.
And the app itself had that built-in way to track if reminders were being seen or responded to.
It did. The percentage of patients in the app group who responded to more than 25% of their medication reminders within the app also increased significantly over the study.
And importantly, the study found this internal app measure, this response rate, had a significant positive correlation with the SMAQ adherence scores at months 2 and 3.
Ah, so the app's own data sort of backed up the questionnaire findings, suggests it might be a reliable way to gauge adherence, maybe.
Exactly. It suggests that internal app data could potentially be a useful, maybe even more real-time, way to track adherence in the future.
Okay. So clear and significant improvements in medication adherence in the app group, that seems like a big win. But did that better adherence translate into better health outcomes? What about those clinical markers?
They saw some promising signals there, too, looking at random blood glucose, or RBG.
Blood sugar.
Right. The app group showed a significant decrease over the 3 months.
And compared to the control group, how did they stack up?
The app group's RBG levels showed more significant improvement compared to the control group at both the 1-month and 3-month time points.
Okay, so a tangible, positive impact on blood sugar control. That's good. What about kidney function itself? That's really the key measure for CKD, isn't it? How did eGFR, measuring kidney filtration, change?
Yeah, this is where the results are particularly interesting, maybe a bit nuanced. Within the app group, eGFR showed a significant increase over time.
An increase, so better kidney function.
Well, a statistically significant increase compared to their own baseline, yeah, particularly from baseline to 3 months. The control group, notably, did not show a significant increase in eGFR over the study duration.
Okay, so improvement within the app group, but was the app group significantly better than the control group by the very end of the 3 months?
That's the nuance. The direct statistical comparison between the groups at the 3-month mark didn't quite reach traditional statistical significance for EGFR.
Oh, okay.
However, the study found a significant interaction effect between the app intervention and time for EGFR.
An interaction effect. What does that mean in plain terms?
It basically means the app appeared to significantly change the pattern or the trend of EGFR change over time compared to the control group. So while there wasn't a statistically significant difference between the groups right at that 3-month snapshot,
Right.
the significant improvement within the app group, plus this significant interaction effect, strongly suggests the app has the potential to positively impact the kidney function trajectory. Longer studies are definitely needed to confirm that long-term effect, though.
Okay, that makes sense. So adherence was a big win. Blood sugar improved significantly. And there's this promising signal that the app might be positively influencing the direction of kidney function, even if 3 months is maybe too short to show a definitive between-group difference at the endpoint.
Exactly.
What about the other clinical measures like serum creatinine, hemoglobin, blood pressure, or weight? Any changes there?
Those did not show significant differences between the groups or significant changes within the groups over the 3 months of the study.
Got it. And how did patients find using the app itself? Was it, easy to use, helpful?
Seems like it was pretty good, yeah. The usability score, measured by that ACEs scale.
Right, where over 68 is generally considered above average.
Exactly. It was consistently above that average throughout the study.
Yeah.
And it actually increased significantly over time.
Oh, so people found it easier to use as they went along.
Apparently so, yeah. Which suggests usability wasn't a major barrier here.
But were patients using all the features equally? You mentioned logging data and things.
Engagement definitely varied there. Most patients, about 81%, accessed the educational material. Over half, around 56%, completed the quizzes.
Okay, so good engagement with the learning aspects.
Yeah, but features requiring more active data entry, that was lower. Recording measurements was only about 30%, side effects around 19%, and sending questions to the pharmacist about 26%.
Huh, so people seemed more keen on receiving information in those reminders, maybe less so on proactively inputting their own data.
That's what it looks like. Maybe the active tracking felt like a bit more effort,
Yeah, that's interesting. So let's zoom out a bit and discuss what these results really mean. The study authors emphasize the pharmacist-led aspect quite a bit. How important do you think that human connection was?
Oh, I think it was absolutely crucial. This wasn't just a piece of software dropped on patients. The pharmacist's active involvement, doing the initial training, conducting those monthly follow-up interviews, assessing adherence in person, being available through the app to answer questions.
Right.
That likely provided essential support and, importantly, accountability. It really aligns with other research showing that pharmacist interventions improve outcomes in patients managing complex conditions.
So you're saying, could the app have worked as well without the pharmacist?
Based on this study design, probably not. It really highlights that irreplaceable human element guiding the technology, I think.
And the study presenters noted this was, as far as they knew, the first RCT specifically assessing a pharmacist-led mobile app's impact on both medication adherence and efficacy, the clinical outcomes in CKD stages 3 to 5.
Yes, and that makes this study a really significant contribution. While there have been other health studies in CKD looking at various things like lifestyle or self-management, and some included education or communication, they didn't all robustly measure medication adherence as a primary outcome alongside clinical efficacy in this specific patient group, using this kind of RCT design with integrated pharmacist care. It's quite specific.
So why did the researchers think the app was effective? What's the proposed mechanism behind these improvements?
They suggest it's really the combination of features working together. The personalized reminders obviously help overcome forgetting, a common barrier.
Simple but effective.
Right. The educational material improves patient knowledge and, hopefully, motivation. The direct communication channel with the pharmacist removes barriers, makes it easier to ask questions or clear up confusion quickly.
Makes sense.
And the data logging features, even if they were less used by some, offer a way to track progress and visualize trends, which can be empowering for the patients who do use them.
Of course, no study is perfect. What were some of the key limitations mentioned in the source that we should definitely keep in mind when we interpret these results?
Yes, several important ones. It was a single-center study done at one hospital. So we need to be a bit cautious generalizing these findings to all CKD patients everywhere. Different places might have different standard practices or patient populations.
Okay, generalizability is one.
Right. Also, patients needed to own an Android smartphone to even be in the study. That could introduce a selection bias, couldn't it?
Yeah, maybe people who already own and use smartphones are just more inclined to engage with a health app anyway.
Exactly. Then there's the fact that the laboratory data, like EGFR and RBG, was self-reported by patients. They looked at their clinic results and typed them in.
Ah, not collected directly by the study team through standardized tests.
Correct. So there's potential for errors or inconsistencies there compared to standardized lab measurements. And the 3-month duration.
Yeah, seems kind of short for CKD.
It's long enough to see changes in adherence, clearly, but it's relatively short for seeing major, statistically significant shifts in the progression of a chronic condition like CKD, especially when comparing clinical markers between groups.
And there's always that possibility of the Hawthorne effect, right? Where people change their behavior just because they know they're being watched or studied.
Exactly. That could potentially explain some of the adherence increase seen even in the control group, especially given those monthly pharmacist interviews they also received.
Makes sense.
However, the fact that the improvement was significantly greater in the app group really suggests the app added something substantial beyond just being in a study.
Okay. So, despite those limitations, single center, smartphone bias, self-reported labs, short duration, potential Hawthorne effect. What's the big picture takeaway from this deep dive into this study?
Well, I think the results for medication adherence are exceptionally strong, really promising. The significant improvements in random blood glucose and those compelling signals regarding the EGFR trajectory improving within the app group.
Yeah.
It all strongly suggests that this type of intervention, a well-designed mobile app, especially when it's integrated with the expertise and support of a healthcare professional like a pharmacist, holds real potential for improving key outcomes in patients managing chronic kidney disease.
Right. And for anyone navigating a complex lifelong condition like CKD, having tools that genuinely make it easier to stick to their vital medication regimen, I mean, that could make a fundamental difference, couldn't it? Slowing disease progression, preventing complications, significantly improving their quality of life.
Absolutely. This study really underscores how technology, when it's thoughtfully designed and connected to human clinical expertise, can empower patients in their own health journey and potentially lead to, well, better results.
That makes a lot of sense. And it kind of leaves you thinking. The study showed lower engagement with some of those app features, like actively logging data or sending questions.
Mm-hmm.
Considering this, what would it take to make these kinds of digital health tools even more useful, even more seamlessly integrated into a patient's daily life? How do we shift it from feeling like an optional, extra task to being an essential, easy, and truly valuable part of managing their health routine? That seems like the next big question, doesn't it? The next frontier for using technology in chronic disease management.